What are the characteristics of the arterial pulse? As you know, the pulse is the rhythmic expansion and contraction of an artery, meaning the regular contraction and relaxation of an artery. Anywhere an artery passes over a bone and comes close to the surface of the body, we can check the pulse. When we carefully examine the arterial pulse, we can obtain a comprehensive series of valuable information. What are those? First, pulse rate, or the number of heartbeats. We usually count the number of pulses we feel under our fingers in 1 minute, and based on that we determine the pulse rate. Or we can count the number of pulses in 6 seconds and multiply it by 10, and in that way we get the pulse rate per minute. Second, pulse rhythm, meaning whether the heartbeat is regular or irregular. Normally, and in a healthy individual, we expect the heartbeat to be regular. But if it is irregular, we should consider certain diseases, such as AF or atrial fibrillation, AV block, or frequent PVCs. There is a term called pulse deficit, which means that while we are examining the patient's pulse, we also listen to the patient's heart with a stethoscope and notice that for every contraction that occurs in the heart, there isn't a corresponding pulse. This shows that some of the beats are being missed. In other words, it can be felt, and we can observe this in various diseases, such as those with tachycardia or atrial fibrillation. The next characteristic is the symmetry of the pulses, or pulse equality. In a normal person, we expect the strength of the pulse in both hands to be equal. However, if the strength of the pulse in one hand is greater than the other, it indicates narrowing or obstruction in the arterial pathway, such as narrowing caused by atherosclerosis, Takayasu arteritis, or aortic dissection. And if we observe this asymmetry between the hands and the feet, we should consider peripheral arterial disease or aortic coarctation. The next characteristic is estimating blood pressure based on the pulse. And as you know, the best way to measure blood pressure is by using a sphygmomanometer. But sometimes, especially in emergency situations where this is not possible, we can estimate the level and amount of blood pressure by checking the arterial pulses. We have a rule called the rule of 60, 70, and 80. This means that if the carotid artery pulse is palpable, the patient's blood pressure is at least 60 millimeters of mercury. If the femoral artery pulse is measurable and palpable, it means the patient's minimum blood pressure is 70 millimeters of mercury. And if the radial artery pulse is measurable and can be felt, it means the patient's minimum blood pressure is 80 millimeters of mercury. The next feature in pulse examination is auscultation. This means we use a stethoscope and listen over the patient's arteries and pulses, and if there is any turbulence, we can detect it. The presence of a murmur or turbulence over the arteries and peripheral pulses is called an arterial bruit. What is the difference between a bruit and a murmur? A murmur is heard over the heart, which is due to a pressure gradient between two chambers. But if we have the same pressure gradient and difference in the limbs and peripheral vessels, the murmur sound we hear is called a bruit. The next characteristic we assess by examining the pulse is its strength. Pulses are categorized into 4 groups based on their strength. 0 is when we have absolutely no palpable pulse at all. 1+ is when the pulse strength is quite weak but still detectable. For example, in patients with heart failure, dehydration, GI bleeding, or decreased intravascular volume. 2+ is when the pulse strength is normal in a healthy individual. And 3+ is when the pulse strength is greater than normal. We call this a bounding pulse. Patients with high cardiac output, such as pregnant women, those with anemia, or those with hypothyroidism, have a bounding pulse. And finally, the 7th characteristic that can be determined by examining the pulse is the pulse contour, or the shape of the arterial waveform. To do this, it is necessary to invasively insert a catheter into the artery, then connect it to a monitor and examine the arterial waveform or pulse contour there.